Decoding 2026's COLA. Why this adjustment matters more than you think. As we look ahead to 2026, one question is quietly rising to the top for millions of Americans who depend on federal benefits. Why might your Social Security check change next year? The answer centers on COLA, the cost of living adjustment. While COLA is often described as a routine annual increase, the 2026 adjustment carries added significance because of the economic signals forming right now. COLA is not a political decision. It is a formula-driven adjustment tied directly to inflation data. Specifically, it reflects how much everyday costs, like food, housing, transportation, and medical care, have increased for consumers over time. When those costs rise, benefits such as Social Security, SSI, SSDI, and VA payments are adjusted to help preserve purchasing power. But here's where 2026 becomes different. Economic indicators are showing a complex picture. Inflation has cooled from recent peaks, but prices have not fallen back to earlier levels. For beneficiaries living on fixed income, that means expenses remain high even if inflation slows. COLA calculations must account for this reality, and that can lead to adjustments that surprise people either positively or negatively. This is why understanding how COLA works matters now, not later. The size of the adjustment, or whether it feels meaningful, depends on data that is already being collected today. In this series, we'll break down exactly how COLA is calculated, what economic factors matter most for 2026, and how changes could affect Social Security, SSI, SSDI, and VA beneficiaries differently. Because when COLA changes, it's not just a number on paper, it directly shapes your financial outlook for the year ahead. How COLA is calculated and why inflation data drives everything. To understand why your Social Security check might change in 2026, you first need to understand how COLA is actually calculated and why inflation data plays such a decisive role. COLA, or cost of living adjustment, is not based on guesses, predictions, or political negotiation. It is calculated using a specific inflation measure called the Consumer Price Index for urban wage earners and clerical workers, often referred to as CPIW. Each year, the Social Security Administration compares inflation data from the third quarter of one year to the third quarter of the previous year. If prices have risen during that period, benefits are adjusted upward to reflect that increase. If prices rise slowly, the COLA increase is smaller. And if inflation is flat or negative, the adjustment can be minimal, or even zero. What makes this process critical for 2026 is the timing. The inflation data being collected right now will directly shape next year's adjustment. That means changes in food prices, housing costs, fuel, utilities, and healthcare today are already influencing future benefit calculations. However, there is an important limitation. CPIW reflects spending patterns of working households, not retirees. Seniors often spend more on healthcare and housing, areas where costs may rise faster than average inflation. As a result, even when COLA increases benefits, it may not fully match the real expenses seniors face. This is why beneficiaries sometimes feel that COLA doesn't go far enough. The formula preserves purchasing power on paper, but real-world costs don't always align perfectly with the index. Understanding this mechanism is essential. COLA is not arbitrary, it is mathematical, and the numbers behind it are already in motion. The key economic indicators shaping the 2026 COLA projection. Now that we understand how COLA is calculated, the next step is identifying which economic indicators are most influential in shaping the projected adjustment for 2026. At the top of the list is inflation, but not inflation in the abstract. Inflation in specific categories that heavily influence the CPIW index. These include food prices, housing-related costs, transportation, and energy. Food inflation remains one of the most sensitive drivers. Even when overall inflation slows, grocery prices often remain elevated. Because food is a frequent and unavoidable expense, sustained increases continue to push the CPIW upward, even during periods of broader economic cooling. Housing costs are another major factor. Rent, utilities, and related services make up a large portion of the index. While home prices may fluctuate, rental and utility costs tend to rise steadily. These increases are particularly relevant for seniors who often spend a higher percentage of income on housing than working households. Energy prices also play a critical role. Gasoline, electricity, and heating costs can move quickly and dramatically. Short-term spikes during the measurement period can significantly influence the final COLA figure, even if prices stabilize later. Healthcare costs matter too. But here's the nuance. Medical expenses are included in CPIW, but they are underweighted compared to seniors' actual spending patterns. This means rising healthcare costs may not fully translate into a higher COLA, even though beneficiaries feel the impact directly. Together, these indicators form the backbone of the 2026 COLA calculation. And because the data is gathered over a specific window, timing matters as much as trend. What happens now can echo directly into next year's benefit checks. Why? Slowing inflation does not automatically mean a smaller COLA. One of the most common assumptions beneficiaries make is this: if inflation is slowing, COLA must be shrinking too. For 2026, that assumption can be misleading. COLA is not based on whether inflation is rising or falling in general terms. It is based on how prices compare during a very specific measurement window. Even if inflation cools, what matters most is whether prices remain higher than they were during the same period last year. In recent cycles, inflation has slowed from peak levels, but prices have not returned to where they were before. Food, rent, utilities, and insurance costs remain elevated. When prices stabilize at higher levels, the CPIW index can still show year-over-year increases, and that can still produce a meaningful COLA. Another nuance is timing. A brief slowdown outside the measurement window may have little effect, but even short-lived price increases during the third quarter comparison period can push the index higher. This is especially true for volatile categories like energy and transportation. There is also a psychological gap between inflation headlines and household reality. Even when inflation slows, expenses do not decrease. Seniors feel this most acutely because fixed income does not adjust downward when prices remain high. For 2026, the question is not whether inflation is falling. It's whether average prices during the measurement period remain above last year's levels. If they do, COLA still rises. That's why beneficiaries should not assume a smaller adjustment just because inflation appears calmer. COLA responds to cumulative price pressure, not headlines, and that distinction matters more than most people realize. How 2026 COLA could affect Social Security differently than SSI and SSDI. When people hear COLA increase, it's easy to assume every beneficiary is affected the same way. In reality, COLA impacts Social Security, SSI, and SSDI differently, and those differences matter heading into 2026. For Social Security retirement benefits, COLA is applied directly to the monthly payment amount. If COLA rises by a certain percentage, that percentage is added across the board to existing checks. However, the real impact depends on your starting benefit. Higher base benefits result in larger dollar increases, while lower benefits see smaller absolute gains, even with the same percentage. For SSDI recipients, the mechanism is similar, but the financial outcome can feel different. Many SSDI beneficiaries already live closer to the margin. Even a modest COLA increase may be immediately absorbed by higher housing, utility, or medical costs. The adjustment helps, but it may not feel like meaningful relief. SSI is where the distinction becomes most pronounced. SSI benefits are tied to strict income and resource limits. While COLA does raise the federal benefit rate, it can also interact with eligibility thresholds. In some cases, state supplements or income offsets may blunt the full effect of the increase. Another key difference involves Medicare premiums. For Social Security and SSDI recipients, Part B premium changes can offset part of a COLA increase. SSI recipients, by contrast, often have Medicaid coverage that shields them from those deductions. The takeaway for 2026 is this: COLA is not one size fits all. The same adjustment can feel very different depending on which program you rely on and how close your budget already is to the edge. The Medicare factor: how premiums can offset your 2026 COLA increase. One of the most overlooked factors in any COLA discussion is Medicare. Specifically, how rising premiums can quietly offset a Social Security increase. For many beneficiaries, Medicare Part B premiums are automatically deducted from monthly Social Security or SSDI checks. That means when COLA increases your gross benefit, Medicare premiums can reduce how much of that increase you actually see. This interaction matters even more heading into 2026. Historically, Medicare premiums do not always move in the same direction as COLA. In some years, premiums rise faster than expected, absorbing a significant portion of the COLA adjustment. In other years, premiums stabilize, allowing beneficiaries to keep more of the increase. The uncertainty is what makes planning difficult. There is also the hold harmless provision to consider. This rule protects many beneficiaries from seeing their net Social Security check decrease due to rising Part B premiums. However, it does not guarantee that beneficiaries will keep the full COLA increase. It only prevents a net loss. For higher income beneficiaries subject to income-related monthly adjustment amounts, or IRMA, the situation can be more complex. Premium increases for these individuals can significantly reduce or even exceed the COLA increase, resulting in little to no net gain. SSI recipients are largely shielded from this issue because Medicaid often covers their Medicare costs. But for Social Security and SSDI beneficiaries, Medicare premiums remain a critical variable. As we approach 2026, understanding how COLA and Medicare interact is essential. The headline increase may look encouraging, but the net result depends on what gets deducted before the check reaches you. What VA beneficiaries should know about COLA changes in 2026. For veterans and surviving family members who rely on VA benefits, the 2026 COLA adjustment carries its own set of implications, and they are often misunderstood. VA disability compensation and dependency and indemnity compensation are COLA-linked, meaning they generally rise in line with Social Security adjustments. When COLA increases, VA payments typically follow the same percentage increase. This alignment is designed to preserve purchasing power across federal benefit systems. However, there are important nuances. First, VA benefits are not subject to Medicare premium deductions. That alone can make COLA increases feel more meaningful for VA beneficiaries compared to Social Security recipients whose increases may be partially offset by Part B premiums. In practical terms, VA beneficiaries are more likely to see the full adjustment reflected in their payment. Second, VA benefits are not means-tested in the same way SSI is. That means COLA increases do not threaten eligibility or reduce payments due to income limits. Veterans receiving disability compensation generally keep the full increase without triggering offsets. That said, VA beneficiaries are not immune to inflation pressure. Many veterans face rising healthcare, housing, and utility costs, especially those living on fixed income or with service-connected disabilities that increase medical expenses. Even when COLA applies evenly, the real-world impact depends on where costs are rising fastest. Another consideration is coordination. Some beneficiaries receive both VA and Social Security benefits. In those cases, COLA affects each program separately, and the net outcome depends on how deductions apply on the Social Security side. For 2026, VA beneficiaries should expect COLA to track closely with Social Security, but to feel different in practice. Understanding that distinction helps veterans better anticipate how their monthly income why healthcare and housing costs matter more than the COLA percentage. When COLA numbers are announced, most headlines focus on the percentage increase, but for beneficiaries, especially seniors, that percentage often matters less than where their money actually goes. Healthcare and housing dominate senior budgets, and they do not behave like average consumer prices. Healthcare costs, in particular, tend to rise faster than overall inflation. Premiums, copays, prescription drugs, and out-of-pocket expenses can increase even in years when headline inflation slows. Because healthcare is underweighted in the CPI-W index, COLA may not fully reflect these increases, leaving seniors absorbing the difference. Housing costs tell a similar story. Rent, property taxes, insurance, utilities, and maintenance expenses continue to rise steadily across much of the country. For seniors who rent, annual increases are often unavoidable. For homeowners, insurance premiums and property-related costs have climbed sharply in recent years. The problem is not just higher prices, it's budget concentration. When a large share of income goes toward housing and healthcare, even small increases in those categories can wipe out the benefit of a COLA increase. This is why some beneficiaries feel poorer even after their check goes up. The COLA preserves purchasing power in theory, but real-life expenses are not evenly distributed across the index. For 2026, this reality will shape how COLA is experienced. A modest percentage increase may look acceptable on paper, yet feel inadequate once higher medical and housing costs are paid. Understanding this gap helps beneficiaries set realistic expectations. COLA is a cushion, not a cure, and its true impact depends less on the percentage and more on the costs you cannot avoid. How timing and measurement windows can change the 2026 COLA outcome. One of the least understood, yet most powerful factors shaping the 2026 COLA is timing, not when the adjustment is announced, but when inflation is measured. COLA is based on a strict comparison, the average CPIW reading from July, August, and September of one year compared to the same 3 months of the prior year. This narrow measurement window means that what happens outside those months often doesn't count, even if it affects household budgets dramatically. For example, if prices spike in the spring and then level off by summer, much of that increase may already be locked in to the CPIW baseline. Conversely, if inflation surges late in the year, after September, it won't affect COLA until the following cycle. This timing effect can lead to outcomes that feel disconnected from lived experience. Beneficiaries may feel intense price pressure during months that simply don't register in the COLA formula. By the time adjustments arrive, costs may have already risen and stayed high. For 2026, this matters because inflation trends have been uneven. Some categories have cooled, others remain elevated, and some, like insurance and healthcare, have risen steadily regardless of broader trends. If these increases are concentrated within the measurement window, they weigh heavily on the final COLA number. The key takeaway is this: COLA is not a rolling, real-time adjustment. It is a snapshot comparison taken at a very specific moment. Small changes during those months can meaningfully alter the outcome. Understanding the role of timing helps explain why COLA results sometimes surprise beneficiaries and why patience, not headlines, determines the final number. Why some beneficiaries will feel the 2026 COLA more than others. Even if the 2026 COLA percentage is the same for everyone, not everyone will experience it the same way. The real-world impact depends on personal circumstances that go far beyond the headline number. The first factor is benefit size. A COLA increase is applied as a percentage. That means beneficiaries with higher monthly payments receive a larger dollar increase, while those with smaller checks see much less. For someone already struggling on a low benefit, even a reasonable percentage may feel insignificant. The second factor is expense structure. Seniors and disabled individuals who spend a large portion of their income on housing, healthcare, and insurance are more likely to see their COLA absorbed quickly. If most of your increase goes toward unavoidable costs, the adjustment may not improve daily financial flexibility at all. Another major difference is program interaction. Social Security and SSDI beneficiaries may see COLA partially offset by Medicare premiums. SSI recipients, by contrast, often avoid those deductions, but face strict income limits that can reduce the net benefit of increases. VA beneficiaries may feel COLA more directly because their payments are not subject to Medicare deductions. Geography also plays a role. Beneficiaries living in high-cost areas experience price increases that often outpace national averages. COLA is national, but expenses are local. Finally, timing matters. If costs rise earlier in the year and COLA doesn't take effect until January, beneficiaries may spend months absorbing higher prices before relief arrives. All of this explains why COLA can feel generous to some and disappointing to others, even when the adjustment is the same on paper. Common misconceptions about COLA and what it can and cannot do. As discussion around the 2026 COLA grows, so do misunderstandings. Many beneficiaries assume COLA is designed to improve their financial situation. In reality, COLA has a much narrower purpose, and misunderstanding that purpose often leads to disappointment. The first misconception is that COLA is meant to raise living standards. It is not. COLA is designed only to preserve purchasing power, not to increase it. Even a sizable adjustment is meant to help benefits keep pace with inflation, not to make beneficiaries better off than before. Another common belief is that COLA reflects seniors' actual expenses. As we've discussed, it does not. COLA is based on CPIW, which tracks spending patterns of working households. Seniors spend more on healthcare and housing, areas that often rise faster than the index. This mismatch explains why COLA can feel insufficient even when inflation adjusted on paper. Some beneficiaries also assume COLA applies instantly or evenly throughout the year. In reality, COLA takes effect in January, long after many price increases have already been absorbed. It is backward-looking, not real-time. There is also confusion around guarantees. COLA is not guaranteed to be large or even positive. In years when inflation is flat or minimal during the measurement window, COLA can be very small. Finally, COLA does not shield beneficiaries from other changes. Medicare premiums, taxes, and state-level adjustments can all reduce the net impact. Understanding what COLA can and cannot do helps beneficiaries approach the 2026 adjustment with realistic expectations instead of frustration. What beneficiaries should watch as 2026 COLA data continues to develop. As we move closer to the final determination of the 2026 COLA, beneficiaries should understand that the number is still being shaped in real time. The adjustment is not locked in until the official measurement window closes, which means current economic data still matters. The most important thing to watch is monthly inflation reports, particularly changes in food, housing, energy, and transportation costs. Even modest increases in these categories can shift the CPIW average during the July through September window that determines COLA. Energy prices deserve special attention. Gasoline and utilities are volatile, and short-term spikes during the measurement period can disproportionately influence the final adjustment. A sudden increase at the wrong time can raise COLA, even if prices later fall. Housing-related costs are another critical indicator. Rent, utilities, and insurance premiums tend to rise steadily rather than fluctuate. If these continue upward through the measurement months, they provide sustained pressure on the index. Healthcare expenses should also be monitored, even though they are underweighted in CPIW. Rising prescription drug prices, insurance costs, and out-of-pocket expenses may not boost COLA significantly, but they strongly affect how meaningful the adjustment feels. Finally, beneficiaries should be cautious with early projections. Estimates change as new data arrives. What looks like a modest adjustment today could shift higher or lower, depending on how the next few months unfold. For 2026, awareness matters more than prediction. Understanding which signals drive COLA helps beneficiaries interpret updates without overreacting to speculation. How to prepare financially for a COLA change before it takes effect. Even though the 2026 COLA will not take effect until January, the months leading up to it are not a waiting period. They are a preparation window. The first step beneficiaries should consider is budget awareness. Reviewing where money is currently going helps identify which expenses are rising fastest. Housing, healthcare, insurance, and utilities are often the areas that absorb COLA increases first. Knowing this ahead of time allows beneficiaries to plan realistically instead of assuming the adjustment will create extra flexibility. Second, beneficiaries should avoid building expectations into their spending before the COLA is finalized. Because the adjustment is not guaranteed to be large and could be smaller than recent years, counting on a significant increase can create financial strain if the final number falls short. Another important step is monitoring Medicare-related costs. For Social Security and SSDI recipients, Part B premiums and other healthcare expenses can change alongside COLA. Understanding how deductions affect net income helps prevent surprises when January payments arrive. Beneficiaries should also review withholding and deductions, including taxes where applicable. Even a modest increase in gross benefits can alter withholding amounts, affecting take-home pay. For SSI recipients, preparation involves understanding how COLA interacts with income limits and state supplements. In some cases, increases may be partially offset, making planning especially important. Finally, preparation is mental as much as financial. COLA is a stabilizer, not a solution. Approaching it with measured expectations allows beneficiaries to adapt calmly rather than react emotionally. In short, the best way to handle a COLA change is not to wait for it, but to be ready for what it realistically can and cannot provide. The bottom line on 2026 is COLA and what it means for your financial outlook. When all the projections, formulas, and indicators are stripped away, the bottom line on the 2026 COLA is this. Your benefit check may change, but how it feels depends entirely on your personal situation. COLA is designed to respond to inflation, not to guarantee comfort or financial growth. It adjusts benefits based on past price data using a formula that does not fully reflect how seniors, disabled individuals, or veterans actually spend their money. That gap is why COLA can look reasonable on paper yet feel insufficient in real life. For 2026, the outlook is shaped by a mixed economy. Inflation has slowed, but prices remain elevated. Housing, healthcare, insurance, and utilities continue to strain fixed incomes. Whether COLA meaningfully offsets those pressures will vary widely from one beneficiary to another. Some recipients, particularly those with higher base benefits or fewer deductions, may notice a clear improvement. Others may see most of the increase absorbed by Medicare premiums, rising medical costs, or unavoidable living expenses. The most important takeaway is not the percentage itself, but preparedness. Understanding how COLA works, what drives it, and how it interacts with Medicare, SSI rules, SSDI, and VA benefits allows beneficiaries to plan calmly instead of reacting emotionally. COLA is a stabilizer. It helps prevent benefits from falling behind inflation, but it is not a cure for long-term financial stress. As 2026 approaches, clarity matters more than speculation. Knowing what COLA can and cannot do puts you in a stronger position to navigate the year ahead with realistic expectations and greater confidence.